Hello, this is Dr. Lazar Jancic from Leederville Chiropractic Clinic. This month I'll be talking about many of the common conditions affecting the lower limb, which can be ankle, knees, and hip joints. The ball and socket, the hip joint, as well as that pelvis and low back. Just to differentiate, a lot of people confuse hip joints with pelvic sacroiliac joints. So if we have a look at our pelvis over here, these two joints at the back are your pelvic joints, technically called sacroiliac joints. The true ball and socket hip joint sits here in this socket, looking like that. And that's often the joint that many elderly people have replaced. But often people call these bones and this back region their hips. So just a bit of a distinction to start off with. So this video in particular will be about hip conditions and hip problems. And first of all, a lot of people are surprised that chiropractors don't only work with the spine. That's a common misconception. Some chiropractors like to specialize in what we call peripheral joints. But we certainly are trained to work with every single joint in your body. So if you have any aches or pains in any joint, you should consider chiropractic. But the hip joints are a very common problem, often leading to surgery and hip replacements. I've seen many in my time. And sometimes they're warranted, but often people haven't considered something more conservative. And considering that hip replacements are pretty invasive surgery and procedures, you should really consider something more conservative. And new research is showing that, for example, chiropractic adjustments to the low back and pelvis and the hips are able to reduce over 60% of the hip pain that people are experiencing. That's pretty significant and could make the difference between the pain that you're getting and having to need surgery or not. Just remember, those hip joints, in fact, every joint in your body is really designed to last a lifetime. And if you're having pain, it's very unlikely to be age-related. And that hip joint is often thought to be an age-related problem, but really it's not. And what we now know is that proper maintenance and attention to the hip joint or any joint can really prolong the life of your joints and make the difference between having pain or no pain. Another common condition that I find affects that hip region is the hip flexor muscles. That's a group of muscles at the front of your pelvis, just above your groin or around your groin. If you or someone you know is experiencing pain in that region, it's usually muscular. It can actually be the hip joint as well. But if it's muscular, it's often connected to, believe it or not, either overuse or underuse. The most common is underuse, I find, from my experience, and it's to do with a lot of sitting. You see, we are not designed to sit. And when you sit for long periods of time, as many of you do, those hip flexor muscles, the muscles in the groin, they will contract, they'll shorten and tighten, and start to create pain and inflammation. So often moving more and stretching those groups of muscles out can make a big difference. However, sometimes it's also overuse, particularly if you tend to not use your body enough. When you do tend to use it, it can be, the muscle group can be overused. So if you've been sedentary for a long time and then all of a sudden you decide to do some sports or activity, you need to really ease into it, because you can create this overuse injury and tendinitis in those muscles, and that's commonly what happens as well. So you need to figure out, is it overuse or underuse or some kind of combination. But certainly as a chiropractor, that's what I'm trained to do. So if you're not sure, by all means, seek advice and we can figure it out. Until next time, this is Dr. Lazar Jancic, and remember, this month is all about the lower limb. So stay tuned for more videos. Thank you.